So you can take a sheet from here. So let's take this and do it because, all right, pull it off and give me one, please. So that's what it means. Cardio means heart, pulmonary means lungs, and resuscitation means revive or bring back to life. Now it's on your book in page 5, so I'm not going to tell you how to spell it. It's easier for you to look at it. All right? So that's what it means. CPR. We're dealing with the 2 vital organs in the body. If our heart stops, our lungs doesn't work. If our lungs stop, the heart doesn't work. So in order to be alive, we have to have both of those working. All right. Now the next alphabets that you're going to be familiar with, and you all can look on page 5 and give me the answer. It's AED. What does that stand for, Kinlan?
AED?
Yes. On page 5, right down the bottom, CPR. All right, he's coming up with it. Glenroy?
Automated external
defibrillator.
Okay. Automated external defibrillator. So write that, please. A stands for automated. What does automated mean? It's automatic, but it speaks to us. It's not just automatic, but it speaks. Sorry. I'm terrible with handwriting. That's why I need to be retired. I'm a nurse.
It starts something.
Yes. You turn it on and it talks.
Right.
You must listen. And the machine that you can have fun with today is this. Because we're humans, when we know to do something, we prefer to start doing it without being told, right? So we're gonna see this. And external means what? It means outside the body, okay? And you see how that's spelled there? So outside the body. Oops. And defibrillation or defibrillator, that's spelled in, we nurses and doctors, we abbreviate. Okay, that's a machine that actually shocks the heart. It has an electrical current that shocks the heart back into rhythm, hopefully while we're using it. Now, for those who've never had CPR before, don't have the slightest idea, I need to go through this with you. I represent the American Heart Association, which is the most current training guidelines that you can have because they do research every 4 years. And this is why you have new books this time because there's some changes. And you notice they've added first aid in there and some more extra pictures, okay, which is good. So before 2011, we were doing, and what did the A stand for? Benoit, you remember? What did A stand for?
Automated.
No.
Sorry. Oh.
What's this, the mouth and the nose called?
I don't remember.
Okay, mine what?
Airways.
Okay, we're airways. So your airways, okay, so look at that. Your A stands for airways, B stands for breath, and Glenroy, you want to tell me what C stands for?
Compression.
Yes, somebody said that. Okay. And then the D stands for defibrillation, which is this machine. Okay. Now, what the American Heart determined in research, we were reviving people, but they were brain dead. The heart was ticking and they were breathing, but the brain was dead. So they really were like vegetables. What was the use of reviving them if they were no good to themselves? So I'm so glad they did that research because they've determined now that we waited too long before we started compressions. And the blood was not circulating to the brain. So, and we thought gasping was a breath was normal, like this. American Heart determined it's that heart has already stopped. It's just gasping, that because the lungs are saying, what's going on? It's nothing, no blood is coming to my lungs. So gasping is not normal. Now this type of gasping is different. That's different. That's like an asthmatic like myself. But that type of gasping tells us that that person's heart is already stopped. But we as medical people, we thought, well, they're not dead yet because they're still gasping. We felt for the pulse in the carotid area, and we could feel a thin little thing underneath our fingers, and we thought, oh, the heart hasn't stopped yet. But what had happened, the heart was stopped, but it was trembling because what's happening, what's going on? So that trembling of the heart was just barely trickling the blood through to the pulse. So they determined that we waited too long, and by the time we got to the third step, the brain cells had already started to die. So they have changed it. Now 2011, it's been changed, and now it's compressions, airway, rests, and defibrillation. So this is no longer the right one, this is it. Compressions, airways, rests, and defib. So now that we're dealing with COVID, it's even more important, because what does it tell us? That someone who's unresponsive, the most important thing is their compressions. We don't have to breathe them if we can't, okay? And if it's blood on the face or the mouth, you would do that anyway. You would just continue taking a break, 10 seconds, and coming back to compressions, because we found that we've got people revived and they were useful to themselves, okay? So this is now the sequence. So you remember now today, when I asked you what's the priority for the victim who's unresponsive, it's compressions, not breathing them. It's compression. That means circulating the blood to the brain. Now I must apologize, because everything now is online, and this thing will be going back and forth. The other time, remember, we had a DVD?
Yes.
Much easier. But anyway, we're gonna work with this. We don't have a choice. So I'm gonna play a bit of the video, let you watch it, and then I will come back and talk about it, okay? Now, any questions about these three things that we discussed? They also did a research 2011, another one in 2015. And we used to do compressions at a rate of 80 to 100, which means we're trying to get the heart to beat at least 100 beats per minute, getting the blood to the brain. But they determined that we needed to go faster. And also, we were afraid to break ribs or do some damage to the organ. We didn't go deep enough. So they're telling us now we need to go hard and fast. So they have increased the depth. It used to be, they want to make sure you get at least 2 inches, okay? The book doesn't say that, but the review that we did is 2.4. So we want to make sure we're getting at least 2 inches. And that's about that. Now, how do you tell that in a real person? You got to push down pretty hard to do that. So you guys are very, very energetic, full of energy, force. Yes.
Sorry, I was able to answer a question. Wouldn't hard be relative based on the person? Because when you have a big, strong person, you need to go hard. He may just crush them while somebody else.
Good question. All right, so if you got a really delicate little old lady or a little old man, you can use one hand. Because you're right, if you go down with 2 hands, you're going to damage, you're definitely going to fracture ribs, okay? So you're right. So you base your discretion on what size. But for an adult, and the American Heart, as you read in your book, should have read, it's not by age, it's anyone who has reached the age of puberty. And if you have a big child like 9 years old and they haven't reached the age of puberty, you're going to still use 2 hands because you've got to get that force going down at least 2 inches on the chest. Now, let me ask a question. Is unresponsiveness the same as unconsciousness? Think about it. Is it the same? Those 2 things are the same. I see Ken Roy says no. He's right.
No.
It's not. What's the difference? What's the difference between someone who's unconscious and someone who's unresponsive?
Unresponsive is
Go ahead,
it stops breathing. Unresponsive.
Okay, unresponsive, there's no response. Unconscious, there's no response, but they're still breathing and their heart is still pumping.
Yeah.
So unconsciousness can lead to unresponsiveness, right? But we're going to be doing CPR on unresponsive people. Now they're telling us that if we're in doubt and we tap the person and they didn't respond, maybe they're intoxicated so highly that they didn't respond to you, you turn them over and you do the trachs and then you start doing compressions and they cringe and they get off my chest. Well, you woke the person up. The person did need CPR, but at least you got a response from them. So they tell us, if in doubt, you start CPR, compressions anyway, because you're not certain. And some people are breathing, especially the elderly, they breathe in the abdomen. And sometimes if they have, covering there, you might not see the chest rise, you see the abdomen. So that's the difference. Unresponsive people versus unconscious. Now, is a heart attack the same as cardiac arrest? No. Ken Roy says no again. He's correct. All right, because heart attack, you have the symptoms. You have chest pains, you have shortness of breath, you have sweating. You have time to tell yourself, oh, something is happening. Cardiac arrest, it happens really quickly. Just like police stop you, you have no warning. So it's cardiac arrest patients that we are going to, or patients, I say patients because they're people that we're going to be doing CPR on. Now, heart attacks can lead into cardiac arrest. You hear people say they had a massive heart attack and died. That meant that there was no more muscle in the heart to work. So the last part that was damaged, there was no heart muscle to pump. So the person died of cardiac arrest, okay? All right, now we talked about the Good Samaritan law. He was asking, hopefully the American Heart, the criminalists do enough training, they should have the coverage when it comes to American Heart. Need a pen? Oh, yes, thank you, thank you. Remind me, I give you a giveaway when we're through. So the Good Samaritan law says to us that if we are trained and certified, and say we did CPR and we fractured a rib, and the person is a little bit painful in breathing, they can't sue us because that's a risk. The American Heart says, you're alive. It's better to be alive with a broken rib than not be alive. So we did it out of goodwill because we knew what to do. And lots of times we do fracture a rib, but ribs can heal. American Heart will not cover us for negligence. Now, what does that mean? We know that CPR has to be done on a hard, flat surface. Why? Because if you're trying to do CPR on a bed or a couch, you're not getting, you're just squirting blood. It needs to be something hard. So when you push down, you're squeezing, forcing the blood out of the heart to the brain. So they're saying that if I did a shake, say for instance, I found someone in a field, grass field. We know the ground is hard and grass covered. We assume that it's okay. But we didn't really check, and the person was lying on that. And we started doing compressions, as we were supposed to do after we made the checks. And all of a sudden, blood started coming from the mouth of this victim. What have we done? We have fractured the ribs in the back because there's a stone in the grass that we did not see. You know, you get these sharp stones and a pebble or whatever, and you go down forceful. You fractured a back rib and punctured the lungs. We will get sued for that. So remember, when you're doing CPR, if you ever have to do CPR, make sure it's a hard, flat surface. If not, you are wasting your time and energy. So don't even try it. So if someone is in a bed, unless you can get a board put on behind them, like a big Atlas board, something that's hard, that will separate them from the mattress. No good of doing that, okay? Yes, but suppose we can't, remember now you have dead weight. Dead weight can't help you, okay? So you may not be able to do that. You have to be careful that you don't injure yourself and injure them. Now I said the victim who is unresponsive, their priority is compressions. But for us who's giving that CPR or first aid, our priority is safety. So if we're not safe, we're going to be the second victim and nobody may not come around and we get 2 dead instead of 1. So always remember that when, even though we know things, do not think that it's safe without checking. Other parts of the world, people have been shot, stabbed, and you get in the way there and you'll be the next person. So remember, always check your scene and make sure it's safe. Because this also goes to your safety when it comes to the 5 things. Once we start CPR, the only reasons we can stop, and that is for the adult, is if we become exhausted. Now, if you become exhausted doing CPR, you call 911. For an adult, you should always call 911 before you even stop, because hearts are usually sicker, and you're going to need that help. They're harder to do, compressions. So always make sure that 911, and I'm gonna have you do this right now, so we don't forget it. Look on page, and this is the chain of survival. Page 23 in your book, and you'll see a chain there, a red. Let's talk about that while I'm thinking of it. Then we won't have to do that on the video. All right, you see the chain of, this is the American Heart chain of survival. They're saying if we follow this, we are more likely to revive and be successful in saving lives. So the first thing, you find someone unresponsive and it's safe for you to go to them. You're gonna tap them, okay? If they don't respond or if they're only gasping, then you're gonna call 911 or call someone to help you, and they call 911. If you don't have a phone and you called and no one came to you, you must get a phone, because you're not gonna start compressions, because you're gonna become exhausted before and you wasted the time and this person is not gonna survive. So always make sure that you call for help. Now we all carry cell phones these days, okay? Yes. So you can put them on speaker and call and just tell them. Now, when you're calling 911, what's two important things that, as a first aider, I always think of, that they need to know?
Location.
The location, where you are, okay, because we really don't know what happened to them, but we know CPR. We're trained in CPR because they're gonna try to tell us what to do. And can they talk to us while we're counting? Or we can't talk back to them. So remember, those are two things, and I always remember as an instructor, those are two important things for them to know first. Because if they know that you know first aid and you're starting CPR, you don't have a watch on, they got your time when you started. So whenever the doctor, somebody says, how long you been doing CPR, 911 has the report, okay? So let's get back to the other four reasons. So the first reason is, if you become exhausted, that's your safety. If you don't stop, you're gonna collapse as well. The second one is when EMS shows up and someone takes over. The third one, if someone comes and says, I know CPR, and they can help, then you switch every 2 minutes. The other one is if a doctor's around and said, how long you've been doing CPR, and they say, oh, 45 to an hour, and the person is blue and black and purple. The doctor says, stop. There's no way we're gonna get this heart started and we even use the AED. And the third one is if somebody wakes up and says, get off of me. What are you doing to me? All right, so if they're revived, you're gonna stop. You're not gonna continue. The thing about this machine, it tells us what to do once we turn it on. So once we're doing CPR and we don't have anyone helping us, but someone brought that and they don't know how to do CPR, we're gonna have to stop a little bit to put this on quickly so that we can get this working and hopefully shock the heart. Now, not all the time with shock a heart, it works, especially for the elderly or the older people, an adult, because their heart might be sick, okay? Heart failure, enlarged, whatever it could be. All right, so remember those 5 reasons. All right.
What is EMS?
What is EMS? Medical emergency medical services. That's the paramedics, yes, sorry. Yeah, the ambulance. Yes, that's great. I'm using my medical terms, so that's great. EMS, emergency medical services. Great. Okay. Oh, so what we're gonna do is just play a video, a short video. Someone turn the lights. Do you know where the lights are? And we're gonna listen to this because this is real life.
It was early in my shift at the cafe, around 8:45 on Monday.
Don't turn them all
I
off.
was still feeling tired and groggy. A customer ran up to the counter and asked, does anyone know CPR?
Did you
The
see?
man had collapsed outside on the patio. Suddenly, I was wide awake. I didn't have formal training in cardiopulmonary resuscitation, that's CPR, but I had learned some skills from the American Heart Association website and from scouting when I was a kid. At first, I was nervous, but there was no time to waste. Somebody needed help now. Outside, the adrenaline kicked in like a shot of espresso, and I knew exactly what to do. The customer had collapsed in a patio chair. I'll never forget his face. It was pale as a piece of paper. He wasn't breathing, moving, or responding. While someone called 911, I lowered the man to the patio. I remember thinking, I have someone in my arms who was dying, so I started CPR. I put both hands on the center of his chest and just started pushing, hard and fast. I kept doing chest compressions and breaths for about 2 minutes until medical help arrived. I washed up, tied my apron on, and went back to serving coffee. but for the rest of my shift, I wondered how that customer was doing. Later, I found out he was a 66-year-old man named Mike. He survived his cardiac arrest and is doing well. I also found out that most people who witness a cardiac arrest either don't know CPR or are afraid to do it. So, they call 911 and then they wait. Medical help gets there as fast as they can. But in the United States, it still takes an average of 4 to 10 minutes for them to reach someone in cardiac arrest. That means receiving CPR from a bystander is a person's best chance to survive until medical help arrives. It also means any CPR is better than no CPR. My career goal is to be in law enforcement and to do search and rescue. But you don't have to be a medical professional to help save a life. By learning hands-only CPR, you too can be ready to help someone in cardiac arrest. It might even be a friend or a family member whose life is in your hands. On your next coffee break, why not take the time to learn hands-only CPR?
Okay,
What would you do if someone collapsed suddenly in front of you? Although Kirk took action and helped someone he didn't know, you are much more likely to be in a position to save the life of someone you know and love, like a parent, child, spouse, or friend. The skills you learn and practice in this course will help you know when and what to do in an emergency, but also give you the confidence to act yourself. Cardiac arrest can occur without warning or within just a few minutes after symptoms appear and is often fatal if appropriate steps are not taken immediately. Cardiac arrest does not discriminate and can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Welcome to Heart Saver
let's
CPR-AED,
go and watch this.
presented by the American Heart Association. An emergency can happen anywhere at any time, and this course will help prepare you for the types of emergencies you might encounter. For information on additional topics not covered in this course, please consult your student workbook.
Okay, any questions?
Products are shown for demonstration purposes
Go back
only.
to-
The American Heart Association does not endorse or recommend any specific manufacturer or product. For the purposes of
All right. Any questions about
Oh,
her story?
how long after the art stop does the brain take the time?
It's hard to say. All I know is that they're saying we shouldn't interrupt compressions for more than 10 seconds. That's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That quick, that the cell starts to die very quick. And that's what happened when we were doing breathe. We were trying to get breaths in. The meantime, the heart was, yes. So let's go back to the page that you're on. You see where compressions is on page 23? It's the second thing. Okay? So compressions is your priority, but for the adult, always make sure that 911 is called before you start. Because once you start, those are only 5 reasons you can stop. And you will become exhausted if that's a sick heart. And you're still trying to do CPR because it's unlikely that you would be able to get that start.
Why does that apply to, why does that only apply to adults? Come on first.
Okay, because adults' hearts are usually, not usually, they are older. They've been taken a lot longer and they have more health issues than children. So children, it's a different, I'll show you that in a minute. Children, their chain of survival is completely different because they should have healthy hearts. And what's happened with children and infants, usually it's not their heart that stops first. It's usually their breathing, either from asthma, sudden death syndrome, or choking on something. It's usually that they stop breathing first. But remember, when one stops, the other one will stop eventually, if not something is not done. All right, and this then after compressions, if you get the AED, you're going to shock the heart. That's in the middle. Ambulance comes and transports the person. They're monitored in the hospital, and hopefully they're sent home with the family again. So you see that being trained in CPR and first aid is good in saving lives. And we have seen many of the situations where lives have been saved. As a nurse over my almost 50 years, not active nursing, but being a nurse and training, that, not 50 years in training, but that I've done four times. One was I witnessed arrest in the hospital because I saw what was happening on the monitor. We couldn't save her. She had a pulmonary embolism. The other one was a car accident that I went on the ambulance. There was no way we could save that person, but we tried. The other one was an infant at birth that we had to resuscitate, not breathing. The other one was a near drowning. And those two, it's amazing when I see those that grown-up people today, it reminds me of life-saving techniques, because this young boy was with my son, Stephen, in the pool, and somehow he knocked himself out, and they took him out the pool. Nobody knew how to do CPR. Those days, teachers didn't learn CPR, whatever. So we resuscitated him, and he's alive today. The only thing that he has is like a list of speech that you can tell something affected the brain. But otherwise, he's alive and well. So it just goes to show that you may never have to use this, and let's pray to God that you never have to. But if you have to, you need to be able to be prepared and say, I'm going to do the best I can. Because guess what? It could be one of you. It could be me that collapsed somewhere. And if somebody don't know CPR, we'll die. By the time EMS gets to us, my brain is going to be dead, even though they're doing compression. So remember, it's very, very useful. And let's get back to the child while we're at this, so that we don't have to go back to that page. The child is on page, no, it's on page 39, sorry, in your book. It's a purple chain. Page 39. I'm gonna leave y'all can.
And push hard and fast in the center of the chest. CPR requires two main skills: providing compressions and giving breaths. Compressions are the most important part of CPR.
Stephen tried and couldn't get me logged in, so I don't. But I had the same problem at the hospital, so I don't know. This online thing is not, it's not the best.
We'll go over compressions first, and then we'll talk about breaths. A chest
Hey, can we just start over the video?
Yeah,
I mean, like it's loading.
Yeah, so what is
Let's go back to the beginning now.
Go back to the beginning.
Okay.
That?
and
Yeah.
push hard and fast in the center of the chest. High quality CPR requires two main skills: providing compressions and... Now, let's talk about chest compressions and hands-only CPR. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR, if they see a teen or an adult collapse. There are two simple steps to follow. Phone your local emergency response number and push hard and fast in the center of the chest. High-quality CPR requires two main skills: providing compressions and giving breaths. Compressions are the most important part of CPR. We'll go over compressions first, and then we'll talk about breaths. A chest compression is the act of pushing on the chest. When you push down correctly on the chest, you pump blood to the brain and other organs. To perform high-quality compressions, you need to do four things: provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. We're going to demonstrate chest compressions and then give you a chance to practice. When providing compressions, you're acting like the heart, because in a cardiac arrest, it's not beating correctly on its own. By providing compressions, you're pumping blood to the brain and other vital organs, keeping them alive until advanced help arrives and the heart can begin beating on its own. You need to push hard, to a depth of at least 2 inches or 5 centimeters, and push fast, at a rate of 100 to 120 compressions per minute. Let's watch this demonstration. Then you'll get to practice.
Okay,
To provide chest compressions, first move the person to a firm, flat surface. Quickly move bulky clothes out of the way. If the person's clothes are difficult to remove, you can still provide compressions over their clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. It may seem awkward or uncomfortable removing someone's clothing, especially if you don't know them, but it's a necessary step to make sure the AED pads make direct contact with the skin. Remember, Good Samaritan laws protect people acting in good faith, so fear of legal repercussions shouldn't be a reason to not provide CPR. Place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with a beat between 100 and 120 per minute. The Bee Gees song, Stayin' Alive, has a great name and is the correct rate for performing chest compressions. The American Heart Association website provides titles of additional songs that can help you give compressions at the correct rate. Finally, you need to allow the chest to come all the way back up after each compression. This is called recoil, and it's an important step that allows the heart to refill with blood. Our aim is to minimize interruptions in chest compressions to 10 seconds or less. This is true in all situations and for everyone, including pregnant women. Do not delay providing chest compressions for pregnant women in cardiac arrest. Provide high-quality CPR just as you would for any other adult. High-quality CPR can increase the mother's and the infant's chance of survival. The video will now pause while you get in position to practice chest compressions.
Okay, we're gonna do that after the break. We're gonna go through everything, and because we need to get space here. So, any questions about compressions? It is the most important thing.
I would imagine that between 100 and 120 per minute.
Yeah, that's
tire.
gonna
You're gonna be
Fast.
tired, it's hard and fast,
Yeah.
that's
Yeah,
why they
sounds
tell you,
good,
so,
so fast.
Yeah.
2 per second.
let me tell you
I found
today,
my song
yes,
that I
yes,
use.
staying alive. The thing is, all of these, hopefully they're working today and they do have green lights. Did we use them the last time? No, I think we used the hard blue ones
The
the
hard
last
blue
time,
ones,
yeah.
yes.
So these are, they want these because they want you to get real life feeling.
Right.
So you're gonna see 2 green lights if you're doing it properly and fast enough. If you're going too fast, you're gonna see a yellow light, and if you see a red light, it means your hands are moved and you're not in the right position.
Okay.
So we're not gonna be too picky if they're not working, because sometimes the moment of the battery, I'm not gonna, but I need to make sure at least you can hear the click, okay? Now, they did say that if you haven't had CPR training, you can do hands-on. I'm a little bit reluctant. I don't kind of agree with that, because if I didn't know how to do compressions, and I wasn't quite certain where to put my hand, I might just do more damage than good.
Or how hard to push.
Or how to push. So 911 can tell me all those things, but they can't exactly be there to train me at that point. And I would think the American law, Good Samaritan law may not cover me, and said, well, you should have known better, So I am a little bit leery about that, so that's why we're trying to get as many people trained as possible and certified. And remember now, after 2 years, now the next 2 years, these books will remain the same. They do every 4 years, and if it's not a change, they'll keep the book. But if there's an update, then they will have to redo the books. Okay, so compressions. The important thing is to make sure for the adult that before you start, 911 has been called. Now, when you're calling someone for help, like you tap and there's no response or just a gasping, someone help, call 911, and 3 people show up. Now, you know these 3 people. You should point to one or call them by name. If you don't, and you say someone, all three is gonna start taking out their phones and trying to call. Or if you don't know them, point to that person.
Okay.
Because 3 people would have, somebody jokingly said, and it was the truth, that 3 ambulances showed up to a house for one person the other day, and it's because different people called 911. You know, people saw from one house to the next, so they called and 3 ambulances. Waste of time and waste of energy from the personnel. So let's make sure that we're getting just that one person to do that. And if it's someone that you know, God would forbid, because if it's someone you know, this is gonna be really stressful, trying to resuscitate them, but you're gonna try it. When you tap them, call them by name, because if they're unconscious, and that name will help them to, oh, that's me, they're calling, but it says, hey, you okay? It might seem like far away. So always call them by name, if you know the person, okay? If you don't, then you just, hey, you okay? No response.
You always tap the chest?
No, the back, well, if they're on their back, good and well, but most of the time, people are on their sides
Right.
or on their face down,
Okay.
because when they collapse, and which is a better way to do, because they kind of go down with their knees first, instead of falling back and hitting the back of the head, and then we got brain issues.
I would imagine now, in these days, you have to be specific and tell people, whoever it is to call, because the first thing people do now is they everything is out.
Exactly. Start taking pictures.
They grab your
I'm glad
phone
you
and
brought that
start,
up.
Trust me.
Gentlemen, listen to this.
Yes.
You are getting trained today and certified. When you deal with a patient, or I say a patient, a person, you have a right, you're in control to threaten them, you're gonna call the police, because you have exposed their privacy. And you're at fault. Because you see what I'm saying? You be your policeman. Sorry, you cannot do this, get away, or now someone to call the police. And we would know, because they would have that on before we even start doing compressions. So, remember though that you are in control, so take control of that. If you're somewhere where people can get them out of the way, use security, use whoever you can to get them, if it's at the airport or whatever, get them out of the way so you have control of what's going on here, because they will be distracting you.
Especially if it's a female.
Yes, and it's terrible. It's awful. It's traumatizing to the person if they revived, or their family members if they passed away. It's terrible. So you have to be in control and make sure you threaten them. I have had to do that. I did it one time to someone who was drunk, and I never do that again to a drunk person, because he nearly gave it to me. I said, if you don't stop doing that, I'm gonna call the police, and that's the wrong thing to do. But you have to make sure that you know you're in control, because that life and that privacy, you're responsible for, okay? All right, good questions. Anything else? Let's move on to, you know what? I can do the breathing. Can we turn the light on, please? Because breathing, I can demonstrate that. Okay, so remember now, this is the nipple line. You see here, it's right, basically, this is your sternum, which is the breastbone, but if you put it too low, it's gonna snap back. So it needs to be like just in below the nipple line. If you're right-handed, your right hand is usually the strongest, and you wear your watch on the left. So it's better to do in this sequence instead of this, because this is gonna get in the way and you're not gonna be able to see the time. So, but if you have some problem with your shoulder, then you would have to use the strongest one first, okay? But remember now, don't double like this, because that's how you fracture ribs. You go and use this base part of your hand, okay? So you're gonna get to practice when we put the stuff on the ground, but always lock your arms and going down like directly over the victim. Like this is not gonna work. You're gonna wear your arms out, not do a thing. You're just gonna squirt a little bit of blood out of the heart, and it's not gonna get to the brain. So compressions, how many compressions are we to do? 30. Then the next step is go for breathing. All right. So this has a disposable lung, clean lung. All of them are all clean. So you're going to put your mouth in this. I've done this already. I've tested it. So I'll give you alcohol thing, and you're going to wipe it. Even though they're all clean, but I want you to wipe it again. I'm going to give, in order to get air in, an adult, I need to tilt the head. And if I don't squeeze the nose, what's gonna happen? It's gonna come right back up my face, and I don't want that either, okay? And it wasn't effective because it didn't go back into the lungs, okay? Squeeze the nose and fill the head, okay? Pretty strong there. All right, did you see how the chest flipped? Now look at this. I blew, took a deep breath and blew, but nothing went in. So I'm gonna put the head back and go again. The second time it went in, I'm not gonna stop and give a second breath because 10 seconds have gone.
Okay.
That's how
Okay.
important it is. Or if I did this, chest didn't rise, I'm gonna still come back. So gentlemen, this is it, we don't have an excuse anymore. I don't want to put my mouth there. The most important thing is to keep that blood circulating to the brain, okay? Now y'all purchased, or the company purchased some of these masks 2 years ago, so they should be around in different departments. If they're ever used, I need to be contacted so we can get them autoclaved. Because this piece here has my germs in it. And if whoever uses it has their germs in it, and it can be transferred to someone else, okay? It's a non-breathable valve. So we're recommending, and a lot of caregivers are purchasing these now, because they feel safer using a mask because of COVID, okay? So if you're gonna use a mask, because you need to know how to put it on correctly. I laugh because I remember years ago, I've seen doctors do this, doctors are good. But they never get into this training type, they're too busy in their office. So it looks like the chin, doesn't it?
Yeah.
But now they're coming and they're putting nose with the arrow up, because I'm sure they must have seen some doctor do it. Don't tell them doctors I said that, but. So you put it on, okay? This piece now goes inside here. So it seals everything off. You hold it in position and let's see if it'll work. All my germs went in there. Hopefully they're not bad germs. But nothing came out to me, okay? Now, when I'm finished giving 2 breaths, I need to take this off because I'm smothering the person. There's no air coming in the atmosphere. But suppose I leave it on there. Don't interrupt compressions, go back and take it off. It will eventually fall off, or no big deal. It's better to continue the compressions than to interrupt it more than 10 seconds.
For the compressions, it's like paramount.
Yes, it is. You've got to keep that blood going to the brain. Because remember, brain cells die and you're breathing, but you want people not to be unconscious. You want to be them responsive. You want them to be able to respond and have a life that would normally be useful. Any questions about that? So this is a position that you tilt the head again, because sometimes it might be a position that you had it in if it didn't go in. But no more than 10 seconds. So whether 2 went in, or whether 1 went in, or whether none went in, you come back to compressions. And so this is the mask. Make sure it's put on properly. Because when EMS comes, they have these. And you need to be able to help them if you're going to put them on. And they have a thing that you can bag where you don't have to breathe. So if you're doing CPR, but mostly there's 2 in there, they would take over. But you need to be there to answer questions, and everything that you have done, or if you put on AED pads, they remain on until they're finished.
So my question is, COVID, everything is happening. You're going somewhere and you come upon a situation, there's no mask ready to use. You have to go for the moment.
Okay, all right. I'm gonna give you my honest opinion. With COVID now, I wouldn't take a chance. I would open the airway, because it could have been something here that kind of blocked the airway, and I would open the airway, okay? And see if that makes a difference, and come back here. Now, if I saw blood, the person could have had a seizure, and bit their tongue and blood's around them up, I'm not gonna put my mouth on it, because you're putting yourself at a risk. And you remember with first aid, I'm gonna show you about the gloves, but we may not have gloves. So the best thing that we can do is make sure that we're washing our hands. But if you had a cut, like I do here, on my finger, I'm gonna make sure that I don't bring that into any contact with any liquid that's coming from that person. So with the COVID situation, as an instructor, I would say, open the airway, but do not put your mouth there. especially because you don't know, okay? For the EMS people that come, that they would have the mask to do that. But you have them here on this compound, so if a staff member, anybody, please use them, because you can save a life. I mean, healthy men, women, that for some reason their heart stopped, or they had an asthma attack and stopped breathing, whatever, that would be the same situation. Any other questions? Good. All right, no signal, come on. All right, so we're, let me see, chest compressions, give a breath, using a mask. Okay. Do you all think you understand how to do the compressions? If not, I'll have to go back. We'll practice them until you get them perfect, okay? So that way, okay, so let's use adult choking in adults, because that's here. It's too confusing trying to watch the video and do a group, so I prefer to. All right. Can y'all see
Choking
the
in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. We've all been in this situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe during these sections. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone your local emergency response number. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust pushes air from the lungs like a
and
cone.
it just
This
pulls
can
it
help
out.
remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to act. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists in front. Make sure to position yourself so that you are stable in case the person collapses to the ground. Some people find it helpful to stand with their feet shoulder width apart and one leg slightly forward.
Right, so that
This creates
coming
more
down.
Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. And it's
Okay. Choking. Anybody had experience with anyone choking, or are you choking yourself?
Choke under ice.
Right, yeah, little tiny things, because it's went into the wrong passage.
Yeah.
All right, what did we do when we choke? What did, y'all from Jamaica, different countries? I'm from Cayman. Anybody else from Cayman? We did them all, we hit them in the back. Give them the big back slash. And if we could talk, we say, hit me on the back. We asked them there. And they would constantly be doing, because we were doing it, that was making the situation worse. Because when we were hitting them, they were taking a breath, not breathing it out, but it was shaking whatever it was down. Can you imagine a marble or something that's smooth, or a coin or something, and you're doing this? It's gonna slip down. So we never, God was merciful, and we coughed until our eyes were popping out of our head. And that is not good. So if someone is choking, always remember that you as first aiders, you need to pay attention to this sign. Just don't think their throat's hurting because they might have a sore throat. They could be choking. So ask them, as the gentleman did, are you choking? Can I help you? Get his consent, because you mess with him, he might say, I told him not, whatever. Get his consent, because he's still getting nod his head, I can help you. And stand up, I'm gonna show you, I'm not gonna have you do it, because I don't want your food that you had for the morning. Let's put your stand up, let's make a fist. I just want you to put your hands in the right position. So make a fist and with the knuckle in like this, yes. Now it's not like this, it goes like this, and it's right below in the gut. So it's right below, yes. And you can actually feel it when you, and it's not like this. You gotta go like this, it's a thrust. So bend forward, and you can do this on yourself if you're choking. Never ask somebody to hit you in the back anymore, okay? Because that's making it worse, okay? So remember that, and if that person, if you keep doing the thrust, and they're not responding and they're collapsing, you gotta make sure that you're gonna ease them down, and then you've got problems. You gotta start checking for response, because remember, the airway was blocked and they stop breathing, so their heart's gonna soon stop breathing, okay? So remember that, never, because you can do damage if you're doing it like this, down, down, it's a thrust, and it's this part, not this part. It's that, it's right in the angle there, yes, just above, just below, it's in the gut region. You can actually feel it, yeah. Now, you can have a seat, now that you've given me your breakfast. If you have a big person, and that can happen, and we call them obese, you're gonna put their hands in place. Yeah, put their hands in place, and you're gonna come from behind, bend them back, and you're gonna use your hands to grab their hands. So you can do that, because it's better than letting them choke. Also, if there's a chair that has a cushion on it, a back of a chair, you can also use that, but that has to be where, make sure it's in the right place. And really, if you put yourself over that, you're gonna vomit, whatever, clear the airway. So let's remember, choking is one of the main reasons for children going unresponsive. Now, for an asthmatic, I'll give you a story. I'm here by the grace of God. I stopped breathing twice. As an asthmatic, one time I was allergic to penicillin, I was given the injection, we didn't know, I stopped breathing, they had to counteract it. Okay, and the same thing, we're gonna learn today how to use an EpiPen, but they had an epi injection, so he gave me the injection. And then 2000, I had a bad flu, and I was in coughing spasms, couldn't stop. So an asthmatic coughing constantly, or forcefully, it causes the airways to constrict. So that made the situation worse. So if I'm choking as an asthmatic, I cannot cough forcefully and do what a normal person would do, because it would make my asthma worse. So if they're in an asthma attack, forceful coughing is gonna cause more problems. And that's what happened to me. I just stopped. I had what we call a silent lung. Anyway, so I'm here today, thank God, 21 years.
21 years.
Whoa, I got 21 years. Anyway, so be careful. Be careful with the issue of choking, that we make sure that we're doing it and doing it in the right way. Now, if it's a child, I'm not going to show you, but if it's a child, you need to kneel, because the child would be down here and you would be up top, or sit in a chair, because you need to be at the same level as that child. And you wouldn't have to do as much forcefulness, okay? Children tend to grab their throat and won't let it go because it hurts. They're choking. Get their hands away from their throat, because they're actually choking themselves, blocking the airway itself. No air can get it. So tell them to put their hands down, or anyone that you're dealing with. Put your hands down, and I can help you. Okay? So that's choking. Any questions? All right. So the sequence for CPR for an adult is 30 compressions, 2 breaths. Deep breath. And the compressions are how deep? It says the book is 2 inches, okay? And how fast? 100 to 120. So it's called hard and fast. And make sure the scene is safe and that the surface is smooth and flat. Yes. So let's go to the child now. We can move on to that, because I would want to finish all this before we take a break. And I've showed you the mask. I'm gonna just do compressions. I'm not gonna do scene safety. The same thing applies. Make sure the scene is safe before you go to any child. I think we'll leave the light on. It's okay.
You need to push hard and fast in the center of the chest, approximately 2 inches
Wait a
or
minute.
5 centimeters,
Is this
at a rate of 100 to 120 compressions per minute.
all right, they're using two
You
hands.
need to allow the
This is big
chest to
enough,
come all the way back up after each compression.
Hear that click and stay in line? Now, with a child, if you go with two hands, you're gonna have to do less force because you don't wanna go too deep with the force of two hands. Hopefully they're gonna show you one hand. I wish they put this on video. Okay.
You need to push hard and fast in the center of the chest,
Is this what we just watched?
approximately
Yeah.
2 inches or 5 centimeters, at a rate of 100 to 120 compressions per minute. Finally, you need to allow the chest to come all the way back up after each compression.
But remember, for a small child, we're gonna be using one hand, and you can rotate hands. All right, I'm gonna do this for the child's breath.
Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin.
You squeeze the
Then
nose as
tilt the
well.
head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
Okay, they mentioned we need to be looking at the chest when we give it breath, because you might not be able to, you're not gonna hear it, you gotta see it. Here you can hear it when the plastic comes up. But remember that, so when you're doing your breath, you're gonna be looking that way and not this way. All right, let me find the AED and then we'll go to that.
Excuse me, can I just see if I can cut on?
Yes, please. All right. I'm gonna use the AED for the children. It'll be the same. So they're talking paths, different paths.
Let's look more closely at using an AED for children. Even though you may be in the middle of providing CPR, once an AED arrives, use it immediately. Just as with adults, the use of an AED gives the child the best chance of survival. It's just one more step in giving the child the best chance of survival. The steps for using an AED on a child are the same as for an adult. However, there is one main difference. If your AED is equipped with smaller pads, a child key or switch, use them for children younger than 8 years of age. The small pads or child key or switch will deliver a shock with a lower energy dose than the larger pads will. But if there aren't any smaller child pads, or if there isn't a child key or switch, use the larger adult pads. There are many different brands of AEDs, and although they may differ slightly, the same basic steps apply to all of them. When you put the pads on the chest, make sure they don't touch each other. If a child is very small, you may need to put one pad on the child's chest and the other on the child's back. Follow the pictures on the package or pads.
Okay, you notice they have it right in the center there, which is where I was taught that to put it on the underneath here and the other one actually in the back sleeve, because I would have a problem going down, even though it's not affecting the, it would tell me to do CPR, but still, I think that electrode would be in the way of me doing my one hand. So it's better to actually put it on the left side. So if y'all can stand up, and hopefully you can see me here, and we're gonna do this. Now, there's no ladies here, but I had a teacher ask me one time, and think about it. Should this be used, or could this be used on a pregnant lady, whether she's big and pregnant, or you can see she's just pregnant? Could it be used, the shocking machine? Could it be used
I would
safely?
imagine, yes.
They thought, which makes sense, because remember now that we're thinking, this heart has stopped. We want to jumpstart this heart to pumping again. But if I'm touching this person when current goes through, my heart's gonna stop, and this one come out. You understand? Have you been shocked with electricity? Your heart just, you don't know what happened to you? But yes, you feel it. So that's why you need to make sure that people are out of the way when you push this button. Because I can guarantee that electricity there will put your heart down and you'll go right over the victim trying to get you up. Because hopefully the heart comes up. But if the heart didn't come up with one shock, it'll tell you to continue CPR. So what I'm gonna do while you all are standing, I'm gonna show you now. The first thing you do, and when you're doing this, we got about 3 others, so it'll be two and two. And we'll try to keep them in sequence. You turn it on and listen to it.
Remove clothing from the patient's chest.
All right, remove clothing from the patient's chest. Remember when we did the section, we were told that get all the metal, the glasses, the earrings, the necklace, get them out of the way because we're gonna burn the person. Well, American Heart determined that that's not really the case because the energy is not that strong to cause that metal to burn. So they're telling us don't waste time to do that. But make sure we're exposing the chest because we need to know where we're putting these pads. All I did was expose the chest to do CPR. Now you notice, I think one of the first ones with hands on, they were doing it, over the clothes. You really can't see, you're just guessing where you are. So it's best to expose the chest, whether if it's a lady with a bra, just pull it up, or a t-shirt, and expose the chest. Open up, shirt, whatever. So I'm gonna take off the top part. Not gonna worry about a belt down here, or earrings, or glasses, or hairpins like we did before, because that's taking time. The next thing I'm gonna do,
Remove clothing from the patient's
I'm gonna
chest.
do that.
Open packet.
And now I'm gonna
Apply
open
pad
these
on
packets.
patient's bare skin.
And I'm gonna pay attention to where these go.
Pictures.
This one goes underneath the left breast.
Open packet and apply pad
Right
on
here.
the patient's bare skin.
All right, remember, the person that came to help me is still on the
Pads
chest,
firmly on
okay?
skin.
All right, so that one goes there, this
Apply
one goes
pad
here,
as shown
hopefully it's
in
gonna
the
work.
pictures.
There's another one up
Press
here.
pads firmly on skin.
Listen for what it says.
Do not touch the
I would
patient
get whoever's
analyzing
helping
heart
me, and I
rhythm.
would step away. Analyzing heart rhythm.
Do not touch the patient analyzing heart rhythm. Shock advised.
Doc advised.
Do not touch the patient. Press the flashing shock
I would
button.
make sure that everybody's out of the way, including myself,
The shock
and push this.
shock delivered.
Boom.
Begin CPR.
So it didn't bring the heart up. So it's telling you, so you would go in line with this. You keep going, and when it gets to 30, it's gonna tell you give 2 breaths. So I said, we need to listen to this machine. But I can guarantee you today, you're not gonna do it. You're gonna just pick it up and do whatever you think. You're gonna grab these pads because we know that these need to go on and they need to go on quickly. So it tells you to continue. Now, you notice I touched this, I did that while it was saying analyzing heart rhythm. What would happen if I leaned on the thing analyzing heart rhythm? Not gonna give a shock, but analyzing heart rhythm. What's happening is they're trying to see if there's any heart activity in this person. But guess what? I'm leaning against whatever the person is in close contact. Whose heart is it picking up? Mine. So this poor person is still dead, and it's telling us no shock or stop CPR. So it's so important that we listen to the machine. And when it's analyzed and make sure it's not our heart, okay? Because if it is, move away and see what it does again. Then it might continue, yes.
So you couldn't differentiate with if the person is pregnant, the lady is pregnant, and the baby is ours.
No, I'm coming to you, yes. It wouldn't, because the baby, remember baby's in this sack of water, okay? I'm glad you brought up because I forgot that. Pregnant women, this can be safely used, and it should be. Because people thought, or the teacher thought, that if this baby's heart is beating, but remember if this mother's heart stopped for a while, the baby has stopped too. But they're thinking if the baby's heart is working and this one is down, we're gonna knock this one up and the baby's down. So that's not the case. So the American Heart says, use it. It's safe because when this mother's heart is beating, then the baby should be getting the circulation and hopefully the baby's heart starts beating. But if one is down, you're gonna expect that the other one is down as well. But it can be safe to use. I've never had somebody ask me that question, but it makes sense. They were thinking, oh, the baby's still alive, but the mother's heart stopped. But you remember, we didn't know how long it stopped. So the baby's probably heart stopped too. But if we get this mother's heart going, who knows? It might save the baby's life. Okay? All right. Any questions about this?
Yeah, is it safe to use on a person that, for example, is drowning and you just take them out of the pool?
Okay. Good question. No, you need to make sure you dry their chest. Now their chest is going to be cold, but not wet. You know what I mean? If you dry it off, it's going to be cold because they're going to suffer hypothermia in the water. So they're always cold anyway. So they may get a little burn here, but it's better than a burn will heal than to be dead. But you cannot put it into, or if the person is in water, make sure you move it from the way. You got trouble there, okay? Now you hear it, Chessman, I'm picking on y'all. Somebody, the book is telling you, I don't agree with that. Not now with to use a razor and shave. I would cut the why would I do that? When I got two of these, I have two of these in there.
I think the book will say, the kid's supposed to come down patch like if it go the ear part.
Yes, yeah, but it's also telling you about a razor. Don't use it. And I had one of the, it was two young men in the class, and they said, "Boy, that's gonna hurt." Yeah,
that might wake you up.
But that will wake them up. If it hurts, they were not dead. So what it does, what you do is peel it off and put the other one in place. So don't worry about shaving. And it's better. I would take, if I didn't have, I only had one pad, I would endeavor to try to get it down there, let it shock through here, but not use it at all. Okay? All right.
And a special reason to put the pad underneath the left side.
It's negative and positive. And the electrodes will tell you. So you look for the picture on this and make sure this one doesn't go here and that one goes here. It has to go the right way. And if that's why they said if it's a child, don't bring it because you get sparks, negative and positive together.
Okay.
So it needs to be far enough apart where you can still do that. Yeah, you get sparks, okay? So make sure that you're looking at which one goes where.
Yeah.
All right? Because this goes underneath the left breast. Now, if this was a child and we're using, like I said, I would put one here and one in the right shoulder. And so you shoot in the current down through the body instead of across.
What if there is metals from surgery internally?
Oh, good question. Forgot that. All right. Well, they said we shouldn't use it because of metal, but the same thing is applying like for glasses and said, try it. It's not gonna, if it burns, it's better to be burned a little bit because some people have their chest wired together because of open heart surgery. So, but we wouldn't, if you see a scar there, you're gonna suspect that's what happened, especially with the scars. So the other thing is that if you see a lump on any part of the chest, you got lumps for pacemakers. You know what pacemakers are. It keeps the heart going a certain rate. And pacemakers now have been replaced by a silicone lead that goes to the heart. Not metal like it used to years ago, because imagine if you're putting this on over a metal thing, it could do more damage. But they're saying just do not put the pads over a patch, whether it's a medication patch, whether it's a lump, because it could be for dialysis, it could be for chemo, it could be a pacemaker. So if there's any lump, avoid putting this over it. Okay? Make sure that the pads doesn't go over that at all. If it means putting it on the back, you would tell the person you can do that. All right, good question. Did I answer your question there? Yeah. All right. So that's CPR. Compressions given to your breast. When this comes, you're going to use it. Make sure you're listening to it once it starts talking to you. Don't go ahead and start picking up things and try to put it on so you can the whole thing off. All right? All right, have a seat. Any questions? All right, so when you get down there, you'll know what to do, right? All right, so well, let's go for the infant now, because that is different. It is different in depth and
Let's look more closely at using an AED. Even though you may be in the middle of providing
okay, chest compression.
As you know, to provide high-quality compressions, you do 4 things. Provide compressions that are deep enough. Provide compressions that are fast enough. Allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. When providing high-quality compressions, pushing hard and fast is just as important with infants as it is with children and adults. Make sure the infant is lying on their back on a firm, flat surface. Some people find it easier to use a raised surface. Quickly move bulky clothes out of the way. If an infant's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Remember, one of the main differences in infant CPR is that you use just 2 fingers, 2 thumbs to provide compressions. Watch this placement if you're using 2 fingers on the infant's chest. Put 2 fingers of one hand on the breastbone, just below the nipple line. Press the infant's chest straight down approximately 1.5 inches, which is 4 centimeters. After each compression, let the chest come back up to its
You're
normal
going to the
position.
brain.
You'll need to give compressions at a rate of 100
Rate is the
to
same.
120 compressions per minute. Watch this demonstration for placement if you're using the 2-thumb encircling hands technique on the
This
infant's
is
chest.
the new one now.
Encircle both hands around the infant's chest, placing your thumbs on the breastbone, just below the nipple line. Press the infant's chest straight down, approximately 1.5 inches, which is 4 centimeters. Remember, if you can't achieve the appropriate depth, you can use the heel of one hand, just like you learned in CPR for children.
It depends on how
Now,
big that child
The
is.
video will pause while you get
Right.
into position to practice providing chest compressions to an infant.
Do that. All right, any questions about the difference with the,
As you know, to provide
about the compressions and the weight stuff? I'll demonstrate when I'm finished with this. I want you to see the breath, different breath.
As with children, when an infant's heart stops beating, it's usually because they can't breathe or have trouble breathing. Therefore, it's important to give breaths as well as compressions to an infant who needs CPR. When you give a breath, opening the airway correctly will help keep an infant's tongue out of the way. Opening the infant's airway too far can actually close the infant's airway, making it
Right,
difficult
see
to
the
get air
difference?
inside.
Tilting
Follow the
over.
techniques you're about to learn to make sure you open the infant's airway correctly. So, let's look at the steps for opening the airway and giving breaths to the infant. And remember, this should be done quickly during CPR, never interrupting chest
Same.
compressions for more than
Never
10
interrupting.
seconds. We'll show you how first, and then you'll get a chance to practice. To open the airway, follow these steps. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the chin. It's important to avoid pressing into the soft part under the chin because this might block the airway. Also, don't push the head back too far. This might close the airway as well. The infant's head should be in a neutral position. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths.
It said a
Go
normal
for
breath,
1
1
second
deep
for
breath.
each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air as adults or even children to make the chest rise. But you'll only know the infant has gotten enough air if you do see the chest rise. Let's watch one more time.
infant mannequin that you can use. Now, they say you can use 2 fingers like this. I have arthritis in that one, so that would be hard for me. But it's basically in the same position, okay? 2 fingers, like this. Now, I tell the ladies that have these claws, you cannot do CPR with that. You're gonna actually break your fingers or break the nail off, and it's not effective. They said, well, can we do it like this? I said, you got the claws hitting against each other, so you can't do it. So basically, I mean, it's out like that. You can't put the force of your thumb or your finger with claws, okay? Now, what they're telling you is now the new thing that, which to me would probably, this would have to be my technique. Because now my fingers, I don't have the energy in my fingers. I'd have to hold them down to do that. Could you hear it clicking?
Yeah.
So basically, what I could be doing, my hands are around the back here, so I've got this kind of hard, support, okay? But you cannot, the nails, you could never do it with nails. And you're gonna indent the skin and you're not gonna get within, how deep do we go for the infant?
1.5.
1.5, okay? And how fast are we gonna go? Same thing, 100 to 120, okay? So that's the dip. The same 30 compressions. But you remember now, you don't get as tired, you get tired of counting, but because you're using 2 fingers and you can always switch, okay? And the other technique if you have a problem. I would not recommend this because if it's a 9-month-old and you've got space in there, that's a different, but you got really a wide area to cover. So it would be better to try to use the 2 fingers, okay? Now, you notice that the breathing, the breaths, it's different. One of the things they said about the AED, usually we don't have small enough pads. Usually we're not using AED on infants anyway, out in the field. It's usually when they're doing heart surgery and infants or whatever, but it's not something that you have those pads for infants. So you wouldn't be, but for children you do. Now, the breaths, the same thing applies, that you're gonna give 2 breaths, but those breaths are gentle. If I take a deep breath like I do for the adult, I'm gonna be compelled to blow out too hard, okay? Because it's in there, so I need to get it out. But I'm not gonna take a deep breath like I did for when I'm doing the infant, because I'm gonna over expand the lungs and I could rupture the lungs. So I'm gonna give gentle breaths, okay? Hold the head in this position, because if I don't, and I don't have to hold the nose, I'm just holding this plastic down. I don't have to hold the nose unless it's too big. The infant's between the mouth and the nose is too wide. You see the chest come up? So it's gentle breaths. Now look, if I do this, you see, I'm gonna just literally expand that long, and I've got too much air in there. So for an infant, we need to make sure it is smooth and gentle. So I wouldn't get up and take a deep breath like I would normally do.
What does the breath do? Start the lungs?
Yeah, the breath going in should start triggering the lungs. Put air in, it would have to come back out. You know, so you're actually trying the same thing.
Jumpstart.
Yeah, jumpstart, yes. But if you can't get the air in, suppose this child choked on something, we don't know what it was, it's still there. We're not doing choking because the child is unresponsive. Okay, but I'll show you in a minute about the choking. Now, if it's, I think the books will tell you sometime, you can either close the mouth or the nose. If it's too far apart, don't try to close the mouth. It's better to get low into the mouth than through the nose. You get a better entry into the lungs that way, even though we breathe through the nose as well. Okay? Same thing applies. Now, when you're putting this on, because like I said, you all have these here, this would go over, not on the inside, but it would go over. Let's see if it's gonna work. I would have to blow a little bit harder because I'm trying to get through this valve. Did it come up? It did, okay. So basically you would have to be the same thing. You would not hyperextend the head, but hold the head in a position so when your face goes down on it, it doesn't move. The same thing applies. If the first breath didn't go in, you kind of juggle the head. The second breath didn't go in, you go back to compressions. That's how important. Now, when you're looking at a child or an infant, not a child, but an infant breathing, looking down at them is hard to see. Have you ever, when you had kids where you look at them and you think they stop breathing, they're not breathing at all? You know, you gotta look, see that chest coming up, okay? Because especially if you're gonna expose it, whether it's a onesie or a what do you call it? Sleeper, where you expose the chest, you would look like this and see, because looking down like this, you might not see what's happening. But remember now, when you're in doubt, start CPR. So even the pressure from doing compression will cause that infant to be aroused. So it's not gonna, it'll hurt them enough to wake them up, okay? Because when we get this afternoon talking about seizures, you'll see that this can happen sometimes with seizures. They're in such a deep sleep that they look like they're dead, that they're not breathing at all. Any questions about infant CPR? So we're going to tap the child and the adult on their shoulder. Infants do not respond like that. They respond tapping on their foot. They come into the world with us beating up the right, and so they tap. And if you know the infant's name, call them by name as well, because who knows? They might just respond to that. Yeah. All right. Any questions?
So when you're doing the breath thing,
The mask?
yeah, you don't have to bring back the head of the
No, it's the same position that you put it in. If you tilt it back, you're closing the airway, okay? It's the same position that you would give a normal breath without the mask. Because their little legs are short, so when we do this, it actually closes, you saw the picture there, it actually closes the airway. So if we gave a breath, it might have been we had it too far back. So we need to reposition it, move a little bit less further back in order to give them. But those breaths need to be gentle, especially without the mask, and a little bit more forceful with the mask so that you can at least get the chest right. Yes, sir.
If the adult or the child is on a flat surface, land on their backs, how much can you tip back? I mean, there will be
Okay, well good question, because sometimes when people go collapse, their head falls back. They do. They're not like this. They usually their head falls back. So you would tilt it this far for the adult. So basically, the base of the head, it would have to be, you can't leave it, the adult will be blocked like this. So you have to tilt it on a far, even if it's on a hard, flat surface. Well, that's where we need to have it, on a hard, flat. But it needs to be tilted like that. Like this, it will not work like that one, because the adult's airway is open like this. Now, once we have resuscitated someone, and they didn't fall from a ladder or something that we suspect neck injury, spinal cord injury, the recovery position, and the old books had recovery, they don't even have it in there, that you're actually going to turn them on their side. Because that way, when you turn them on their side, the tongue falls back, or if it's someone that has a seizure and they're sleeping, whatever's in there will drain out instead of going back down into, possibly the airways, okay? So, and whenever you're trying to get someone on from your back, you're gonna actually grab their shoulder, their clothes from the shoulder and the hip, and you're gonna turn them this way, never away from you, because they're dead weight and they can fall on their face like that from you. So it's always turned this way. And once they're turned on the side, then the head, one hand can come this way, the other one's gonna come over here, and of course the legs, you bend the knees. So that way they stay in this position. Hello, who is here? Okay. Thank you. You can put it over there. So that way you ensure the person that the tongue isn't going to be there to block, because someone who's unconscious, a tongue can fall back and block the airway. That's one of the biggest things.
Any special side or just?
It's all, they're saying left side. They're saying the left side. Cardiologists are changing that. It doesn't really matter now. But left side is probably the best. It's nothing wrong, because it does give a better flow. You're getting pregnant, that side as well.
Again, that probably would depend on what side your arm.
Yeah, yeah.
Because if one side is blocked. then-
Right, one side is blocked, you're right. So it depends, but we never turn them away from us. We always turn them so that we're using our knees to help get them down. Okay? And you don't want them going on the face completely, you just want them on the side.
I know in the past they said to
Sorry.
set them a certain way with their legs.
Yeah, the legs, yes.
Is that the same?
Yes, the same
Okay,
thing,
so-
yeah, I would say put it back in there, but it's, you bring this leg over so that the knee actually positions. Any of you sleep on your sides
Yeah.
and pull your knees up,
Right.
yeah, so it's that same position. And basically what you're doing is protecting your
Right.
head like this is over here, and then this leg is pulled over. So that they don't go back on their belly, or they do not roll back on their back, they stay in that position. It's a much better alignment for their spine. Pardon? Have y'all heard of sleep apnea?
I heard of it.
Nurse? Sleep apnea, you haven't heard? Okay, and it's, I'm not saying it's to scare people, but it's
You sleep
usually
on the
people
breathe.
that are short and kind of like really obese, heavy. Our pregnant women, sometimes with the belly up here, you know, when they lie flat on their back, they actually stop breathing in their sleep. And so it's apnea means no breathing. So, and when they wake up and like they've had a nightmare.
Okay.
And they're tired in the mornings when they get up. My dear sister didn't know what was wrong. I said, get checked out for sleep apnea. I'm tired all the time, and she's short and overweight. So she, you know, they have to use these machines now, because if sleep apnea is severe, the person might stop breathing and stop breathing.
Yeah, I think a few years ago, that Supreme Court judge died from that. He didn't put his machine on.
Mishan, and yeah.
Yeah.
And if you stop long enough, then it's not gonna start again. So sleep apnea is something that is very serious. And people now, I've learned as a nurse, many people since COVID, including myself, have put on weight and lockdown and the whole works. And weight gain is one of those things that attributes to it. Because especially if the abdomen it pushes up against the diaphragm. So sleep apnea is something that if you can actually die from if it's not treated soon enough. Because the longer you're doing it, it's like the more you stop breathing, the less likely you're gonna start breathing again. So sleep apnea is really something, and lots of times kids will start snoring, and many times because they're on their back. So it's better to turn the kid on the side, and never, belly sleepers are not good either. You know that, right? Sleeping on your chest? I see. Orville, you sleep on your belly? Leave it to men. Okay, but seriously, it is better to always try to start out sleeping on your sides. It's always a better way for your spine and your breathing as well.
I also.
I know this has nothing to do with CPR, but what do you call this condition when you say you're sleeping and you choke, whether you're choking on your and it's acidic?
Acid reflux.
Acid
You're
reflux.
choking on it, yeah.
Acid reflux.
Acid
It's
reflux.
really severe. It's almost as if you're.
It's burning,
true,
it's
yeah.
burning.
It happened to me twice.
It's
and I was
Acid reflux,
Acid
yes.
reflux.
That's hangover.
He should know, right? He knows, he
It
says.
feels
"I
like
know."
it's stopping your breath.
No, for me,
Yeah,
I wasn't hangover,
yeah.
and it's very, it's
It's
very
scary,
It's
yes,
scary.
okay.
Because
yes.
I was so frightened. I
You thought you were gonna choke to death?
I thought I was gonna
Yeah.
just I just grab some
So,
water and I
yeah, and have you seen a child with acid
Well,
reflux?
I've never-
An infant? It is bad, because they will scream, they'll wake up screaming, because you don't know what's wrong, and of course the acids come up, and then they start vomiting. So for acid reflux, they're telling us, don't eat anything after 7 o'clock at night, nothing heavy, and make sure your head is not flat. Your head is up, so that whatever's in there is staying down and not. So even on your side, you need to have your head elevated. But acid reflux is not, it's not a good thing to continue, because it will affect your throat. That acid, that stuff staying in your throat.
Acid reflux is a similar thing to sinus or the.
No, they're two. Sinus is actually the drain from here into your throat.
Yeah.
Acid is coming from the stomach, the stomach. And it is over, you know, and it's probably eating habits,
I think, yeah.
eating late, spicy foods, drinking alcohol of hangover.
I think probably I was.
You drink alcohol?
He's had a few.
I think he probably had a few. Because it was really scary. It was really scary.
One of the things that I see, and it's really scary, when I was a kid, I saw that, is people who snore. And
Choke on
like,
it.
my old man would snore, and then after a while,
All of a sudden,
nothing.
anything, yeah.
And then you it's like,
And when you're snoring, it could be the adenoids as well as the tongue back in there.
right,
With the tongue, especially if they're, and usually when they were on their
on their
back.
backs, yeah.
And if they're on their belly, it can happen as well because the belly is pushing up the diaphragm and your head is not turned to the side. So
Oh.
it's not the best way. They're telling us start changing our sleeping positions because it could mean sometimes life or death. And the same thing with acid reflux. Never lie with your head flat. Never try to eat anything or drink anything after at 7 o'clock at night.
I was passed out. That's what happened. I was drinking.
Yeah. You know? But it's serious, you know, and you're learning stuff today that you can pass on to your family and it's all about health. And remember, I tell people, if we're not healthy, we're not gonna be able to provide CPR or first aid, you know, so we gotta stay healthy. And we had a doctor that was a smoker in the bride. We need to stop, but we're in good timing and for a break. And he was a smoker, he was a surgeon. And I got at him, I said, Doc, how are you going to be able to, and he would leave surgery and go out and get a smoke and come back in. And you know the mask is on, but that smoke would come, and I'm allergic to smoke, so I would get at him. And he said, yeah, I need to practice what I preach, but he couldn't stop it. So what I'm saying is, can you imagine somebody trying to, a smoker? First of all, you're gonna probably end up in emphysema or whatever.
Yeah.
Yeah, pushing out, you puffing all of that smoke into there because you don't have the lung capacity. Do you hear me how I have to catch my breath at times?
Yeah.
It's because I've had that problems with my breathing, and today I was a little bit wheezy. And I'm waiting to take my spray when I'm demonstrating, because I don't want to take too much of it. But it is important that we keep healthy in order to keep being able to help people and help others to keep healthy. This afternoon we're going to talk, remind me I talked to you about Lucozade. Anybody drink Lucozade here?
Yeah.
Give you 4.
Oh, that seems like I should put my hand down.
No good thing.
It's sting your stomach. It's
Most
sting your
Jamaicans live on Lucozade.
Let's drink some Red Bull.
Do you know that?
No, Red Bull out of
Do
it.
you know Red Bull is worse?
Rum and Red Bull.
You know what Lucozade has in it? I understand it has caffeine in it as well. Plus, it's loaded with sugar. As a nurse, we hired people from Jamaica, and they're telling me, y'all live with this stuff, and you take it like water, right? Yeah. And you end up with diabetes. You end up with diabetes. And you end up with issues of heart because the caffeine in it and the Red Bull, the caffeine to keep you awake, is going to cause your heart to keep beating fast. And we've almost lost a young man from Pepsi. I've been drinking Pepsi so much.
I'm
Can you
talking
imagine?
I used to drink like,
So, ladies and gentlemen, let me tell you, y'all are young. You better save your life because we only got one. And let me tell you things like that. Why do we need to drink this stuff when we know it's harmful? If we're addicted to it, clothes come off it slowly. But Lucozade is not a good choice. And we've had parents giving their children Lucozade for sports day. Man, they had energies like anything, but by gosh, by the time they got through, they nearly collapsed. We had to bring them to the hospital. Take their sugar sky high. They're not diabetics, but they're sky high because they've loaded in with so much sugar. They're so hyper, and then the heart starts to raise. So Gatorade is your better choice, and there's low sugar Gatorade. So and now they're selling it 2 for 1. Lucozade 2 for 1. You see that, right?
We have
2 for 1.
What power is
Kill it twice.
Yeah. Yes. But so I cringe every time I go to the stores and I see that. I want to say to the manager, she's gonna kill people, because it's really people are drinking it like water. I've had some caregivers tell me, and they have developed diabetes because of it. Because they've lived, they've done it to get energy to work, to stay awake. And as a result, now they have a diabetic problem.
What about coffee?
Coffee.
Don't.
Coffee is bad for acid reflux. It is bad for acid reflux.
Okay.
It is one of the things, the worst things for acid reflux, because it builds up.
Yeah.
Acid reflux. And coffee with caffeine in it is not good. I've seen people so high on caffeine that they can't slow down. It may not hurt you too much while you're young, but as you get older, my dear husband had to learn that the hard way, that, you know, it will wear your heart out because it causes your heart to race.
No, I'm
Yes, sir.
asking a
Good.
very serious question.
Sure, I know
Personal
you would.
question.
Okay.
Coffee, because, especially Nescafe, I
What's the
don't-
difference in that?
Well, that's the brand.
That's from Jamaica?
That's the brand.
That's
That's the
his
brand.
brand.
I
That's his
use.
brand.
The one that price right says like 2 for 1 in that.
Okay.
I go through like 2 bottle, 1 bottle in.
No wonder you have acid reflux.
No, I'm being serious.
Serious. That's why. It's bad for your stomach.
You're telling me coffee is bad for you?
No, I drink coffee, you know.
No, seriously, I go through, I mean, sometimes it's so
Seriously.
strong, and sometimes it's
And
so
it's strong, it's like an
it
acid
feels
type
like
thing.
it can,
Yeah.
it can burn the very hair off your
So
skin.
can you imagine what it does in here? So you have, it's, the worst thing is down here is a mess.
I grew up, you know, with my parents saying it's strong like coffee, you know.
Yeah, it's strong in the mind, yeah.
So I, no, I'm being serious, I'm being honest.
Serious.
I go through those.
Let me tell you, we, coffee drinkers, abused coffee drinkers, or Pepsi or Coke with caffeine, it's affecting health.
Yeah.
So there's, and Lucas said, big time.
Just drink it in moderation. No?
Yeah,
What's
So
the
you-
moderation?
yeah, moderation.
What is moderation?
Moderation is 1 cup a day.
1 cup a day.
Well, I drink 1 cup a day, but well, sometimes 2.
It's like more.
I drink like a cup.
You drink it like
Yeah, but it's not strong like you're drinking it, it's causing.
But you 1 cup of 5.
Mm.
You 1 cup of 5.
Your 1 cup is like espresso.
Yeah, that's- yeah. So, but you know, it's addictive, you know that, and
Yeah, but
Lucas
don't-
said it's
If I
addictive.
don't drink coffee, a cup of coffee, I'll get headache.
Yes, so you should have a headache.
Withdrawal symptom.
No, seriously, because it's, coffee, the caffeine is messing with our brain.
Yeah.
But you need to slow it down, and I'm getting back to my dear husband. When he had a heart and lung transplant, he had to change everything in order to go back to decaf coffee. He hated it because it didn't taste the same.
Me too.
But we had an alternative. We had an alternative. And so now I can't drink coffee. And I'm thankful I'm not doing that now because I did.
I feel like I want to find it, that
But
touch decaf.
you can touch it. You just tell yourself you can't.
One question like how we on this. What causes sleep paralysis?
Sleep paralysis, that's sleep apnea you're talking about or what? Why sleep paralysis? How do you describe sleep paralysis?
You sleep when you see somebody they say, come on, call you and can't call you.
Okay.
You say to them, move your finger and can't.
Oh, that would have just dream or something.
No.
He's drunk or he's intoxicated with something.
It's like
He's
it's like
intoxicated with something.
Yeah.
He's intoxicated with whatever.
You something to me, but sometimes when I oversleep.
Oversleep.
Yeah.
It's
How
like
you oversleep?
your body, you're not.
Oh, okay. When you can't wake up.
It's like
You're awake.
Are you
You
see what's
still
happening, but
something,
your body
person.
won't react to.
Yeah.
Your body won't react.
Sometimes
It takes a while for
conscious
you
enough
to.
and say, boy, if
Yeah.
you get it, when you're too wiggling, you get too weak. But if you don't get it wiggling, you're not.
Too much.
You know what I mean?
Too much Lucozade. Too much caffeine. Too much Lucozade.
I
It's
know.
personal and it's
I know sometimes.
Paralyzed.
I know sometimes when I'm sleeping, and I kind of feel like you get in a deep trance,
yeah.
and like you want to say something, you want to move, and you can't. No man, not a demon. You're not deep, but I never know about that.
Yeah, man.
That blame his on Lucozade, but seriously,
That's
you have 2 stages of sleep, 3 stages, 4 stages of sleep.
Yeah.
There's different depths of sleep, levels of sleep.
Yeah, REM sleep.
Okay, yeah. And the rapid eye movement type thing, lots of times you think you're seeing or hearing things and you still can't move. So it's basically what pattern you're in, but they say that if you don't wake up when you're supposed to get up, the longer you stay in that pattern, the harder it is to get up.
Get up.
Have you seen that when you're used to getting up early and you stay in the bed for the weekend and you can't get up?
Right.
It's because our body is set for that tune. So it's better to move when you can instead of saying, oh, I need a little bit more sleep. But overtiredness has a lot to do with that. You're getting overtired, and you know why you get overtired? Because the caffeine is in there and won't let you sleep. And when you sleep, when you die, you sleep. That's it.
Okay.
You can't get up. So it has a lot to do with that. So seriously, gentlemen, it's all about lifestyle habits. Yeah. So we don't want COVID hitting anything like that. So
Especially when you're going up in certain age, there are certain things that have to put aside.
definitely.
Like change the diet.
Yeah, diet, smoking, any type of drinks that is addictive, drugs, anything that's addictive, that type of stuff, it really affects us. So,
Stop drinking strong coffee.
You're making everything on
No,
the
man,
these days.
yeah,
That's what
it's
says.
true.
That's what says. Everything
No, man,
on
don't do that, man.
Even and the
Even the
kids.
very phone.
The phone is
itself.
Okay, gentlemen, I said we told them to deliver. We got pizza today. I thought the last time we had Subway, right? Is it pizza that we had?
Pizza.
What happened to the pizzas?
It's there. Pizza's there.
Oh, they're
Oh, it's
oh,
there,
down
yeah.
the bottom.
Down the
Okay.
bottom, yeah.
All right, so let's take a break and eat quickly, because the quicker we can get through with the break and get set up to practice, the quicker we can get out of here today. And I'll be happy with that. So, we won't move the thing till you eat, but then we'll need to move and put the mats down and get it down, so that y'all get on the floor.
No Pepsi, guys. No
You
Pepsi.
But look
You
at
gonna
that.
join us, Mrs. France?
Yeah, you stay away from my class, that's okay.
Yeah.
But don't drink anymore. Yeah, Robin, don't drink anymore.
So then, hold on.
Anything, man. It's nice.
I took
Oh, and it's chocolate bread. A chocolate chop.
Diet Pepsi, that's even worse.
But if I drink
Are you videoing me, teacher?
I
You're intruding on my privacy. You didn't video me. Intruding.
I need to change up the thing that
Yeah, you better not video me like that.